Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. If you have not yet subscribed, please go ahead and do subscribe to this channel. By subscribing, you're helping me. You're also helping a lot of other individuals find this content. So I'd really very much appreciate if you do subscribe. If you have not yet, if you're already a subscriber, thank you so much for supporting my content. For today's video, I would like to share with specifically for individuals who identify as trans feminine, why is it that imposter syndrome tends to specifically increase after getting facial feminization surgery, known as FFS for short. This is a very common phenomenon. I have now worked with so many individuals who have gone through facial feminization surgery, and I have witnessed firsthand for how many of them the imposter syndrome would just skyrocket after facial feminization surgery. Helped a lot of people work through those imposter syndrome feelings. And I think it's one of those phenomena that people are not very aware in a sense of when we think about facial feminization, without a doubt, it's a game-changing surgery for a lot of trans femme individuals, especially those who do care about passing. And it is a game changer because we live in a world where the world judges us based on our external appearance. And when it comes to gender, the world still genders us based on our external gender markers that we all socially, culturally have learned to agree on. And so for that reason, our face is something that is front and center when we encounter other individuals out there. This is why a lot of trans femme individuals get facial feminization first versus getting, for example, genital surgery, because genitals are something that is hidden, something that is not out and front and center to everybody else, except for your intimate partners. So for that reason, people opt out to get other surgeries that are more external, if you will, and facial feminization is definitely one of them because our faces are, like I said, it is visible to all. So for a lot of people, it is a game-changing surgery, and I have seen how people's lives have really bettered and drastically improved after getting some element of facial feminization surgery. And it's an interesting surgery because one would assume that getting facial feminization surgery, your confidence, your self-worth, your self-esteem should drastically increase. And for a lot of people, it undoubtedly increases. And when you think about facial feminization surgery, perhaps the increase of imposter syndrome following getting FFS doesn't necessarily make sense, right? Because why would I still have imposter syndrome, imposter feelings like I'm trespassing, feelings that I don't belong, feelings that I'm faking it, feelings that somebody's going to find out that I'm trans, feelings that people are going to clock me. That's another terminology people use. Why would those feelings go up versus going down after getting FFS? And by now, like I said, I have seen way too many individuals who had an increase in imposter syndromes, feelings following FFS, that it got me personally to spend some time analyzing why this has happened. Why is there such a paradox, such contradiction, where it should really decline versus increase? Why is it then increasing? And one of the things that I discovered that I want to share with all of you, because I think for all of you who are thinking about getting facial feminization surgery, maybe have gotten facial feminization surgery, maybe currently experiencing increase in imposter syndrome as a result of getting FFS, you might be wondering why they're happening. And it can feel very uncomfortable to be in that position of feeling so much better about yourself as a byproduct of FFS, and at the same time, having this internal critic in the form of imposter come front and center. And this paradox, this tension that it creates can be deeply uncomfortable. And I've seen people isolating even post-FFS because of these feelings. What I have learned and what I have realized, and feel free please to comment below if for you it was different or if you had some different observations. The more we all share, the more we learn. What I have learned from working with my individuals is one of the main reasons why imposter feelings tend to drastically increase following facial feminization surgery is because now that you got facial feminization surgery, now not only is your expectation that you will not be misgendered is really high because you're hoping that that's it, you're not going to get misgendered at all. Sorry about that. Let me actually quit my email. But also, there is almost now a bar that has been set even higher because now, whoa, wait a second. I'm one of the girls. Now I am definitely one of the women tribe. I'm one of the sisters. Just to give you an idea. Because now a lot of my clients express feeling like, "Oh, I finally see myself for the first time. I really finally see her." And when you see yourself and you embody yourself in such a beautiful way, you feel like you finally belong. And now that you belong, the internal pressure suddenly skyrockets. It's almost like the internal standard skyrockets. That now you really got to live up to whatever the standard of being a woman is. And with that also comes anxiety that especially for individuals who want to live styles, who don't want to constantly disclose their transgender history, which, by the way, I recommend for people to keep their transgender history to themselves until they get to personal, intimate, deeper connections with people. Because I think it's really nobody's business, right? And it's something that is deeply personal to you. And I think some deep personal things need to be earned, to be trusted, and to be shared. And so there's this anxiety, this pressure for those who want to live styles that now I'm navigating the world and I definitely cannot be clocked and I definitely cannot be found out. And with that pressure, that amount of intensity exactly activates and spirals and spins you into imposter feelings. That's where the imposter syndrome comes from. Again, you would think that it would be the opposite, that the confidence and feeling of belongingness will make all those imposter feelings go away, but it does the opposite. One of the reasons why it is so predominant and present following FFS for trans individuals, for trans women, is because there is still lack of integration. There's still lack of socialization, meaning what I mean by that is, depending how old you are, and I always say this, the older you are, the longer you've been living with gender dysphoria, that means that the longer you've been pretending to be something you're not. So at the time when you do step in the transition and you start evolving into your authentic self, that's what I call by socialization and integration. You are immersing into yourself. Well, if you started to transition in your 40s, think about what a long learned history you have of navigating life in authenticity. And if you've been only in transition 1, 2, 3, 4 years, that's not a long period of time. That's not a long period of time. All of us as human beings take a while to feel like we have a sense of belonging to a particular group. We're all group oriented human beings. We're all, in terms of our animalistic instincts, we're all oriented toward being group. We're not solitary animals. And for individuals who are transitioning, that is still very new, right? That sense of I belong to this group is really new. And with that sense, there's all kinds of feelings that come along, including there's experiences you got to go through in order to belong, all sorts of things. And for that reason, the imposter syndrome will skyrocket. So I find that for a lot of my clients, it becomes really challenging because now they're like, oh my God, there's so much pressure now, Dr. Z. Now there's no doubt that I am a woman, right? That's another thing that people tend to say. And I don't know if a lot of you feel the same way, please comment below. But a lot of my clients say that, Dr. Z, now there's no doubt. Now that I really embody myself externally with my authentic face, there's no doubt that this is me. Whereas before FFS, for a lot of individuals, it still felt like trying. The terminology people use to describe is I'm trying to present, I'm trying to look feminine, I'm trying to look like a woman. Post FFS, a lot of people say, there's no trying, this is me, period. Hello, the world. I'm here and I'm here to stay. I hope all of you feel, by the way, because I just love that feeling when people see themselves and when people feel embodied by themselves. It's so important to have that feeling, it's really important to have that feeling. And it's really important for all of you to feel that feeling. And a lot of people achieve that feeling on hormones alone. So don't forget that too. But with that, again, like I said, that pressure comes in, right? That now is, oh, shoot, it's so clear now I am owning who I am. Every woman that I will be talking to, every man that I'll be talking to, every other gender-wise, gendered person I'll be talking to will be looking at me, and they expect, there's almost like anticipation that they expect me to behave and fully embody a woman that I am now presenting myself to be. The truth is that is not true. We all create these expectations inside of our headspaces that are ours. We all create these assumptions that are just that, they're assumptions based on the scripts, based on our own fears, to then run a particular narrative in the back of our head. And from that narrative, we interact with the world. And guess what? It doesn't make it right. It doesn't make it accurate. And not everybody who looks at you expects you to behave like a woman. And I even had clients who post FFS, would be in group with women and said the pressure was so high and they felt so anxiety provoked that they're going to be found out, that when other women were talking about their menstrual cycles, they had to pretend like they had menstrual cycles too. And, there's no need to feel so much tension and pressure. You don't have to engage in dialogue. First of all, when I'm around women who talk about their cycles, it's not a conversation that's interesting to me. So just keep that in mind. But there's all this external pressure that we create for ourselves that we feel like we got to keep up with. This idea of keeping up with the Joneses in terms of having bigger houses, having better cars, this whole American stupidity of chasing. It's the same thing a lot of times in transition for a lot of you. Except now it's not keeping up with the Joneses, it's keeping up with Barbie, literally keeping up with Barbie, right? How can I look and perfect myself and better and better and better and better to the point where if anybody examines me under a microscope, there's no way they can tell that I have transgender history, which is, by the way, another thing that I encourage all of my clients, because a lot of people I work with, they don't want to claim the word trans woman, which is valid, which is personal. What I encourage people to claim is I am a woman that has a transgender history, because you do have transgender history. Just like I don't want to claim the word cancer survivor, but I am a person that have a cancer history. I like that so much better. I hate the word cancer survivor. So you don't have to claim the word trans woman if it doesn't resonate with you, but you can claim that you are a woman that has a transgender history. And that is okay. And maybe that ownership is going to help you break down out of that imposter cycle. But whether you had FFS or if you're about to have FFS, if your imposter syndrome will skyrocket after, remember that it is normal, it is common, and part of it is a sign, it's a red flag, letting you know that you're now setting expectations, you're setting the bar for yourself too high. You either over-idealizing certain things about femininity, or you either putting yourself under microscope when nobody else is putting you under microscope, and you're creating the strain between yourself and between the rest of the world. And you don't need to. The last thing you want to do is, trust me, is to feel negative feelings of imposter syndrome after you just had such big surgery, FFS. The what I really want you to do is I want you to enjoy yourself. I want you to feel the confidence. I want you to start falling in love with yourself. I want you to step away from self-loathing and and guilt and shame and step into self-loving. And I really want all of you to start worshiping yourself. I really do, all of you. I really want every single of my trans sisters to learn how to embodies the inner goddess within yourself because she is there. She's absolutely there. And not to give shit, not to give fuck what others think. I really want that so badly for everybody. So this is your time to do that. Remember, not everybody can get FFS. And if you're able to get FFS, that's something you've given to yourself. Most insurances don't even cover FFS. So especially if you paid out of pocket, that's something you claimed for yourself. Even though you needed it to battle changes for it, it's still. And so that's really something to cultivate. That's really something to hold on to. That's really something to feel proud of. That's really something to feel, you've done something to better your health. That's really important. So keep in mind that if imposter feelings increase, that's why you're setting up the bar for yourself too high. You're fearing too much being clocked and all of those things, and there's no need for that. So have compassion for yourself, take that bar down. Remember, the whole goal of transition, it's about you not only get in alignment with yourself, but once you get in alignment with yourself physically, then for you to own who you are. And you can't own who you are if you're constantly looking out there and if you're constantly holding yourself as a metric system to others. There's no way you can claim who you are if you do that. You have to hold yourself to your own metric system, and your metric system has to be your personal, it has to be rooted in your own reality. So comment below, let me know if you had FFS. Did you have increase in imposter feelings after it? If you're planning to have FFS, are you afraid that this might happen? What are you already setting maybe too high of a bar for yourself? Are you already thinking about how you may or may not measure up? Comment below, let me know, and I will see you all next time. Bye.